Good morning and welcome to the Wavy Digital Desk. I'm your host, Sarah Good, and today we're going to be talking about mental health awareness on the last day of the month in May. We're going to be speaking with Dr. Charles Dunham with Sentara Behavioral Health Care Center. He is going to talk to us about where it stands right now. We can talk about some of the health shortages, but also talk about the signs and symptoms and talk about what is happening right now in the course of treatments available and therapies and so forth. So I'm going to bring him on now and we're just going to get started on this conversation. If you have any additional questions and you're on wavy.com, make sure to check out the links and resources available throughout the article, as well as numbers to call if you are in crisis or need to seek help at the bottom of the article as well. So I'm going to bring on Dr. Charles now. Hi, Dr. Dunham. Thank you so much for joining me this morning.
Good morning.
I think, it's an incredibly important conversation. I know I'm catching you on the last day of the month, but I think this obviously, and I'm sure you can agree, is something that we should be talking about all year long. But, just to get started, can you talk a little bit about, your practice and the patients that you see?
Sure, thank you. Dr. Dunham, I'm with Sentara, and I'm a psychiatrist and internal medicine doc. I've been focusing on psychiatry and the mind-body connection throughout most of my career. I'm currently working at a behavioral health care clinic in Virginia Beach.
And Dr. Dunham, can you talk a little bit about where the healthcare system for behavioral health stands right now? What's been happening? What have you been seeing happen between maybe patients that come to see you, but then also, people in your field?
Yeah, sure. So, behavioral health has been the needs for behavioral health have been increasing over the past decades, and I'd say since COVID, pretty much everybody knows. It brought a lot of depression, anxiety issues to light. I'll also say that social media has kind of put shine a light on things. People are more interested in mental health, and they talk about their mental health issues on social media, so that's bringing more people to us as well. I'd say in general for behavioral health, we have and in all of healthcare, there's not enough workforce for the people in need of help. So there's always been issues of getting enough people, enough hands to the plow, so to speak. But in behavioral health, that's particularly true, and we've had issues with getting enough people involved in the field and taking care of patients. And so have to find creative and new ways to help take care of people.
And, I just want to give a stat because we took a poll yesterday, seeing how many people were either personally or their family members were affected by mental health. And the poll results, as I'm sure, people, when you have conversations and you ask this question, where 95% people said yes, and then 5% said no. And, the CDC says, 1 in 5 US adults have and live with some sort of mental illness. So that is a huge part of the population that we're talking about that is affected by mental health.
It is, and I think the 1 in 5 number probably underestimates. That's probably the 1 in 5 like right now if you look at it across the nation. But if you look at somebody's history and who they're working with in their families throughout the lifetime, then probably that 95% number makes more sense. I think also people are more understanding and aware what mental health is now, and more likely to talk about it. And so, whereas in the past you'd be like, "No, I'm fine," or "My family's fine," now it's more acceptable, more normal. Well, maybe there is something going on that we need help with.
And I think maybe in prior cases, right, people would get to a point of maybe they feel like they're in crisis to where they're either being told they need help or maybe seeking help. And I want to talk about this preventative care piece that is so huge right now in terms of catching people in this preventative space. And I just want to ask a question, in terms of catching people in that preventative space before crisis occurs, how much better is that for the patient?
It's so much better to find something and catch it before it turns into a crisis. And I would say historically in behavioral health and psychiatry, we've been waiting for people to get into crisis. For example, somebody would be, so depressed they become suicidal, so they seek out emergency room care, or their substance use has gotten to the point where their life is falling apart before they're actually seeking out care. We've done a better job in other parts of healthcare. Immunizations, for example, is a great way to prevent illness. In behavioral health, we're starting to do this more and more. And at Sentara, for example, anytime you have an adult patient who's going to come into a clinic, you'll probably be starting to ask questions in your primary care provider about, hey, have you been depressed lately? How are things going there? And so that is part of our organization's dedication to find people who may be suffering that we don't know yet, and try to get them sooner and get them identified sooner so we can get help for them sooner.
And there's an element of this too that goes into the healthcare systems, that it really is better for the healthcare systems and really the weight that's put on the system to catch it earlier, right?
It is absolutely. So if we catch it earlier, we're able to get you treatment earlier. We're able to prevent crisis. So we're able to prevent people from going to the emergency room in crisis. We're able to prevent people from being hospitalized. Able to prevent drug overdoses, accidental or intentional. Able to prevent other things as well. I think the mind body connection is huge. Everybody probably knows that if you get stressed out or anxious or more depressed about something, if you have headaches, you're more likely to get a headache, more likely to get migraines. That turns out to be true for pretty much every medical condition. So if you have high blood pressure, diabetes, COPD, asthma, etc., if you're dealing with stress, anxiety in your life, those medical conditions actually get worse, and that's because of the stress, stress in the body as well, mental stress, but so physical stress in the body, and that causes those things to get worse. And so people end up going to the hospital and urgent cares and doctors' offices more when they have for medical issues, when they have behavioral health issues as well. And so what we're finding now is it really is a complete approach that we have to do with patients and work to find, are they anxious? Are they depressed? And if so, let's deal with that earlier on before it becomes a big problem.
And it's interesting too, as you explain how it all is connected, people do go to individual doctors, right, to get some of those issues looked at. So instead of taking a look, maybe a holistic approach to people, sometimes you are just going to get treated for, high blood pressure, or you're going to get treated just for the headaches. But how important is this sort of integrative method, or looking at the whole person and trying to figure out what maybe are the underlying causes?
Yeah, so I would say it's probably one of the most important things you can do. Now, don't be surprised if you go to your doctor and they just focus on that one thing. But what we're doing ahead of time is asking people questions, and so we're using the entire treatment team, the entire group of the clinic. And so whenever that front desk person or the nurse person asks you, "Hey, are you dealing with depression?" Or if you go into our emergency departments now, our emergency departments at Sentara very often will ask you, "Hey, do you by chance have a problem with pain medicines? Is there anything we can do to help?" You may be there for another reason, and you're asking yourself, well, why are they asking me this stuff about depression? Why are they asking me this stuff about, pain meds? That is part of us working towards that integrative model. And so in order to do that, we have to use not just the physicians, but everybody, the front desk staff, the nursing staff. We all work together as a team in order to identify folks that we can get in who may have other problems, and then we set you up for treatment. So even though you may just be working on that one thing when you come in there, we're going to create a plan for you, and that plan is going to be useful for this other things.
That's interesting too, because we've all received those forms, at a doctor's office, and you're not really paying attention to some of it, or maybe paying attention to what is more than the actual reason you feel like you're at the doctor. And I want to ask you too, in this part, what are some of those maybe symptoms or signs of mental health? We're talking about obviously things relating to each other, but what are those things that might present to somebody that either a loved one or friend can notice, or maybe they can notice within themselves?
Yes, thank you. I think let's talk about depression. Depression is something that is very treatable. People are suffering and in pain and mental pain when it comes to depression and depression symptoms. So I think, being able to understand it and recognize it's important. So let's talk about depression. For depression, a lot of people, their sleep habits change. Maybe they sleep too much, or they sleep less. Very often they have something we call anhedonia, which is basically the pleasure of life has gone away. Maybe they don't like their hobbies as much as they used to. Maybe they don't like work as much as they used to. Maybe they don't like their spouse as much as they used to. Even the kids. There's there's feelings of the things just aren't as interesting and entertaining. And that's a big sign for dealing with something like depression. Um, People start feeling guilty or shameful feelings about themselves, particularly with current or past actions, like, oh, I should have been a better um, spouse, I should have been a better brother, should have been a better sister, I should have been better, XYZ. And so people start thinking worse of themselves and start having these guilty kind of shameful, thoughts. Um, Energy is often, low in people with depression, and they just feel like they have low energy. Sometimes that comes across as a physical kind of medical complaint. Hey doc, I have low energy. I feel tired, and then your doc may ask you questions about, um, depression. And so if that happens, just know they're not trying to say, hey, this is, you're making something up. This is from something that's in your head. That's not how the body works and the mind works. The mind and body work together. And so, if those things come up, just think about it and answer. Well, yeah, maybe my energy is low because I've been feeling down. Concentration often is decreased in patients with mood problems and depression. Um, Appetite's another thing. Sometimes it goes up, sometimes it goes down. So an appetite change is another thing to look at. People sometimes feel physically slower and they move slower. Sometimes you'll look at a loved one who's dealing with depression and go, they just seem to be there, like, they just seem to lay around a lot. They're not doing much. Is this a symptom of depression? Is that what's going on with them? And then one of the things that we have to also recognize as a symptom of depression is suicide and suicidal thoughts. When somebody's mentally well, they don't think to themselves, "Hey, you know what? I think suicide is a good idea." Suicide and that thought process and that the idea of it becomes something that somebody starts thinking about is a symptom of depression, um, or something else related to mental illness, and it has to be taken very seriously and looked into. And so I think those are all, a lot of the signs and symptoms you can find with somebody they have concerns about. And I would say, when we find those any one of those would be a reason to go to your provider and start asking for help.
And the one about shame, which I think is interesting, or sort of that self doubt, I do think maybe as a society or certain people that to me it seems like experience that. I don't know if that really is a part of their personality or that's something that they struggle with, but I think that one jumped out to me the most, as someone could view that as low confidence, or that they could view that as just maybe experiencing self-doubt or being unsure of themselves. But how do you know if that's becoming a problem? Is it when it's really taking over your thought process, taking over your decision making? Or is it more simple than that? Is it really just the reoccurring thought of that you should feel better as a person? You should not regret every decision you make or every, choice you make throughout the day, and you shouldn't really be having those experiences.
Yeah, good question. So I think whenever they are directly impacting kind of your life, that's when you should take it seriously. And everybody can come up with something. Oh, I shouldn't have done that or should have done this. But if you're changing the way you interact with life and what you can do with your life, then that's an important thing to address. The way I kind of conceptualize it is mental illnesses often take away people's stress, or I'm sorry, mental illness often adds people's stress and takes away people's options and choices. So, for example, somebody may say, "I need uh, I need a job promotion at work. I need to ask for money." Well, I wasn't doing that well, XYZ, so I'm not going to do that anymore. Or I'm going to apply for this job, but I'm going to take myself out of that application because I probably wouldn't be good for that job, so I'm not even going to give myself a chance. Or it could be more serious, like my friends are going out. I don't want to go out with them. I'll go out. I'll just have a bad time. I'm not going to be any fun. They're not going to want to be around me, et cetera. So people's mental illness starts altering the way they make decisions and limiting the choices that they make. And so once that happens, I think that's an important, part of, hey, maybe I should get this taken a look at.
Wow, and then maybe that actually puts them in a spiral or in a cyclical situation where they're taking themselves out. They're taking themselves out from opportunities, whether social, professional, personal. And then, that might lead them down a path where they're sort of isolating themselves as well.
Yeah, and I think it's important to note that some of this is about self motivation and getting it done, but a lot of it is also the symptoms of what you're dealing with. And so it's kind of like, people don't feel well when the blood sugars are high for diabetes. That is a symptom. Well, people don't feel well, and like they don't feel like going out or doing stuff if their depression is also high. And so it's a very similar thing. I think that's the way we should look at it as a society. Not It's not a personal failing. It's not, well, you just didn't pick yourself up by the bootstraps, well enough. It is a symptom of something that's going on that can be changed.
And that's a phrase we've heard a lot, with people that might not understand mental health and mental illness, saying, why can't that person figure it out, right? Why can't that person just get up, be on work on time? We've all heard those things. And I think it's important for what you're saying, to recognize when it is impacting your life rather than maybe just a moment.
Yeah, that's true. So as individuals do have to try to make the best choices they can with their lives, but they have to do that with what they got. And sometimes what they need is more help, more resources, and more engagement to for the treatment of mental illness.
And I want to talk about those treatments, the resources, therapies. You've said this is, a golden age or a golden time, for some of those treatments coming out. Can you talk a little bit about what that means?
Yeah, so this really is a golden era of psychiatry. The number of treatments we have and the evidence behind it and science behind it is really astounding. Even from medications to the talk therapies, we have talk therapies that can get very specific for people's needs. So, for example, if you have a PTSD and you're dealing with some past traumatic events, there's very specific therapies you can get. If you have a personality coping style, personality disorder type issues, very specific therapies you can get. There's also therapies that are kind of been known to help very well with anxiety, depression, and even our medications. We have more medication choices now than we ever have, and we know more about the medications and how they work than we ever have. And so it really is an amazing time, and we're coming out with different treatments for refractory and harder to treat cases all the time. And so those are also available.
And, that is just such a positive thing to hear. And I hope people feel comforted by that, to know that there are options there. Because I think, when you go to seek help in any way that you're trying to, and to be met with things that actually work and actually can improve your life, must be a huge relief for patients.
Yeah, it is. One of the things I like to say is, sometimes if you know somebody with high blood pressure or cholesterol or heart issues, they're not just on one medicine; they're on, two, three medicines for that same thing. In psychiatry, very much we can get away with one medicine because, and many times for depression, anxieties, that we have a one medication that works pretty well for patients. Um, can compare that to some of the other things, the common diseases, diabetes, hypertension, COPD, where people may be on two or more medications, and we do pretty good. And we don't talk a lot about that in psychiatry, but we actually have really good medicines and other therapies to help people.
And Dr. Dunham, I don't want to take up too much more of your time, and I know that we're only scratching the surface. And there's more on wavy.com from our previous interview where people can find out a little bit more and some stories you shared. But I do want to give you a second. Is there anything else, I guess, in terms of Mental Health Awareness Month and just having people really be aware, reducing the stigma, being aware of resources that are available, particularly here in Hampton Roads, where people are watching this. Is there anything that you want to share with them, just as we're ending this conversation?
Yeah, I think that people are dealing with a lot of pain and suffering in silence unnecessarily. I think there's a lot of people who are kind of stuck or not seeking the help that they think they should get, or they're going to wait, or they're thinking, well, maybe it'll get better. I need to wait a little bit longer. And for those people, I'd reach out and say, hey, talk to your provider, talk to a significant other, talk to a trusted friend, talk to anybody. Just reach out to somebody that is in your social circle that's safe and trusting, and talk to them about what's going on with you. You can always talk to your providers as well because we're in an era now where you don't have to live with the pain and suffering like that. There's a lot more that can be done.
Well, Dr. Dunham, thank you so much. And I think, that's great perspective and positive note to end on. So for anyone watching right now, please, listen to the advice or find out other resources in your community. I also just want to say while we're live, there are community resources that are available for people that might not know where to go and also might not know exactly, how to afford treatment or so forth. So there's the community services boards here. There's NAMI, the National Alliance on Mental Illness, that exists, and they have a lot of programs and they have local chapters. So you can find out much more information on wavy.com. It's all linked. So definitely want to, proceed with Dr. Dunham's advice and don't want anyone to feel like they cannot reach out. But Dr. Dunham, thank you so much for spending a little bit of your morning with us. And thank you so much for all of your advice and all of the information that you shared with our viewers this morning.
Thank you.